So I am Dr. Lindsay Oberleitner. I am a clinical psychologist and the head of clinical strategy at SimplePractice. I think it's really important to think through what some of those biggest challenges can be in independent practice because they're very real, but they're also things that we can figure out ways, and I mean we broadly as a mental health community and those that provide services to those in mental health can find solutions to. I think at the highest level, when I think about those struggles, what I often think is I at times have worked in bigger systems, in hospital systems, in community mental health, running a clinic, in these systems that provided the resources and structures to run the practice and allowed me access to people that I could collaborate with when I felt stuck on a case. There were people that I could go to if I was like, this billing isn't working, or they might have even managed it for me. And those are very real things that when you're in an independent practice, all of a sudden you're where it goes, right? You are that limit and you have to build those systems. Some people do it by building out a group rather than staying solo if they want more of those resources and hiring in some of that staff over time as they grow and are able to. Other times, what we need to do is find ways to connect across the independent practice community. It's really isolating at times. So, that connection is important. The tools to be able to connect, and I think using technology in ways that allow us to have, instead of having, maybe I can't walk down the hall to the biller that used to be there in my community mental health center, but I can use technology to answer some of those questions that used to feel so hard to get the answer to or to make it happen and to get through and take some of those administrative burdens off. I also think it's about how we bring all those systems together. I can think about the times, even still, when you make that list of in private practice, what tools do I need to access? It's when we're thinking about each of them, it gets really hard to navigate so many different systems. And the more we can bring those technology and systems under kind of a single roof, it reduces a lot of burden there too, to at least have that as an option, whether people choose to use multiple services or not. Having that ability to do so, I think, is really core to reduce those burdens. And I think the other thing that I would say that is really important to consider is we see an increase year over year of those in independent practice taking patients who are using insurance instead of just private pay. And as we see that transition, there are extra burdens that are very real with taking insurance and continuing to find ways to help clinicians navigate those struggles. Because when you're in a large system, again, someone's helping you navigate it. In independent practice, we need to find those ways to build in that communication, build in those tools to make it easy to manage that billing and take that burden off going to multiple systems that struggle with getting credentialed with insurance. All of those struggles are very real and need answers.